day everyone, I am Koyuri May M. Isidro, a nursing student from Tarlac State University, and today I am going to perform the essential intrapartum and newborn care. So EINC is a evidence-based practice used to provide a safe and quality care for the birthing mother and for the newborn within the 48 hours of intrapartum care and within the first week of the newborn's life. So the purpose of this is first to provide a safe and quality care for the birthing mother and for the newborn. Second, to perform the recommended practices for the birthing mother within the intrapartum, antepartum, and immediate postpartum care. And lastly, to provide the recommended practices for the newborn delivery. So, to start the procedure, first is we need to prepare a decontamination solution. So, the decontamination solution must follow the 1/9 ratio of solution, wherein when we will use 1000 ml of decontamination solution, 100 ml will be the chlorine and 900 ml will be the water. So, the decontamination solution will be used later to decontaminate gloves and other equipments that are needed to be decontaminated. So, next is prior to the transfer of the patient to the delivery room, first is we need to establish rapport. So, good day ma'am, I am Koyuri May M. Isidro po, the student nurse of this hospital, and I will be the one po who will gonna assist po your delivery. So, to verify your identity ma'am, can I ask for your name? Also ma'am, can I look at your wristlet? Okay po. So, we are going to perform the essential intrapartum and newborn care po to provide a safe and quality care for you po and for your baby po. Is it okay with you po, ma'am? Okay. So, after establishing rapport, ma'am, are you comfortable na po in your position or do you want to change your position po? Hindi naman po kayo nahihirapan. Okay. So, do you want to eat, drink? Do you want to void po? Hindi rin po. So, upon conducting internal examination, ma'am, your cervix po is 7 cm dilated. So, in that po, ma'am, you will experience more frequent contractions. So, mas sasakit po siya. However po, dahil po doon, mas mabilis po natin makikita si baby. So, konting push na lang po mother and lalabas na po si baby. Okay po. So, when the patient is already in the delivery room and in preparation for the delivery, first is we need to prepare the beddings of the patient. So, in here, we have underpad. Below, we have kelipad that is connected to the basin. The kelipad will be used when there are fluids that are released. It will just directly flow into the basin. So, after that is we need to check the room temperature. So, the room must be 25 to 28 Celsius and free from air draft. So, by that, we will use a piece of paper and we will fall it directly to the ground. If it falls directly to the ground, it means that the room is free from air draft. So, the paper flows directly to the ground, so it means that the room is already free from air draft, and it means that the windows and the doors are already closed. So after that is, ma'am, are you comfortable po in your position? Do you want us po to change your position? Di naman po. So, I can see po, ma'am, that you are in a semi-upright position wherein that's good po, ma'am, because it may reduce the labor time po. Okay po. So, after that is you need to ensure your patient's privacy. So, ensuring your patient's privacy means closing the doors and the curtains so that your client will be more comfortable and secured as you perform all the procedures. And then next is we need to perform hand washing technique. So, performing hand washing technique means following the WHO recommended steps such as the 1, 2, 3, 4, 5 procedure. So, after performing a hand washing technique, next is we need to arrange all our needed equipments in a linear sequence. So first is we need to have a clear resuscitation area. So the resuscitation area must have IV lines or IV fluids, oxygen tank, ambu bag, and rubber section that will be used in case of emergency. For the first part, we need to have two pairs of gloves, dry linen, bonnet, cord clamp, plastic cord clamp, instrumental clamp, scissors, oxytocin injection, and 2 kidney basin. For the other side, we need to have diaper, adult and newborn diaper, BCG, vitamin K, hepatitis, and erythromycin that will be administered for the baby, and all the other equipments that are to be used later. So after arranging all our materials, now is we will clean the perineum area of our patient. So for cleaning the perineum area, we will use antiseptic solution wherein it is composed of water and a little bit of soap, and then we will clean it with a forceps and gauze pad. So we will just clean it. We will just pour the water and then clean it in a single motion. Make sure to clean it properly. So after that, you need to discard the waste material into the proper placement. And then after that, you need to perform hand washing technique. However, in this, more simpler way of hand washing technique will be performed. So after washing or after performing hand washing technique, we can now put on our sterile gloves. So after wearing our gloves, we can now proceed to the next step. So, at the time of delivery, first is you need to encourage your patient. So, mother, upon conducting internal examination, I can see po that your cervix is fully dilated. So, konting push na lang po, mother, lalabas na po si baby. So, after that is we need to put a dry linen on top of our mother's abdomen because later we will use this for skin to skin or for thorough drying. So, after that, mother, ayun na po, nakalabas na po yung head ni baby, crowning na po. So, konting push na lang po, mother. When delivering the baby, make sure to perform perineum support and support the head of the baby. Perineum support will help the mother to avoid further laceration. So, mother, konting push na lang po, lalabas na po si baby. Okay, mother, nakalabas na po yung head ni baby. Don't push na po. Okay, wag na po kayong mag-push. Isusupport ko na lang po si baby. So, when the head of the baby is out, position your hands or your fingers like this and then pull the baby downward and then upward. So, when the shoulder of the baby is already out, you need to place the baby like this and then call for the time of birth. So, baby's out po, time 3 p.m. So, the baby is a bouncing baby girl mother. So, we can now put the baby on top of the mother's abdomen. So, for the first 30 seconds, we need to thoroughly dry the baby. So, we will thoroughly dry the baby. Drying the baby will stimulate breathing and circulation, and it will also help us assess if the baby has any abnormalities. So, it will be used for quick check. So, we will pat dry our baby. We need to start from the face, head, trunks, and extremities of the baby. So, for the first 1 to 3 minutes of the baby, first is you need to remove the wet cloth. And then, you need to put the baby into a prone position between the breast and the abdomen of the mother. So, after that, you need to cover the back of your baby and then you need to put bonnet. So after putting bonnet on your baby's head, you need to perform skin-to-skin contact. So skin-to-skin contact may produce benefits such as mother and child bonding, success in breastfeeding. The baby will be exposed to the maternal skin flora, and then it will stimulate lymphoid tissue, and also it will stimulate or it will produce sugar that will reduce hypothermia, and it is also good for thermoregulation. So when skin-to-skin contact is already performed, now is we will check the abdomen of the mother. So we will inspect if there are any possibilities of second child. So we will inspect the perineal or the abdomen of the mother. So after inspecting the abdomen of the mother and you are already sure that there are no second baby, you can now administer oxytocin. So oxytocin will be administered intramuscularly. So it will be administered to the deltoid of the mother. So oxytocin will be administered 10 units, so 1 cc. So we will now administer it to the deltoid of the mother. So first, we will disinfect the deltoid part of the mother. And then we need to place 3 fingers below the shoulder bone of the mother. And then we will inject the, we will already inject the oxytocin on the mother's deltoid, and then we need to aspirate the plunger, and then if there are no blood or you don't hit any blood vessel, you can now slowly inject it while you are massaging the deltoid of the mother. So after that, you can now put the cotton balls and then massage it and then dispose it on the tray. So after giving the mother the oxytocin, we can now remove our first set of gloves. So make sure to decontaminate the glove first before disposing it. So we will put it in the decontamination solution, and then we can now start palpating the umbilical cord. So we will palpate the umbilical cord of the baby. So first is we will change the position of the baby first, and then we will palpate its umbilical cord. When the pulsation stops, we will now put the umbilical clamp. So we will put the umbilical clamp 2 centimeters below the umbilical base. So after putting the umbilical clamp, we need to put 3 centimeters we need to put the instrumental clamp 3 centimeters below the umbilical, below the plastic clamp, and then we need to cut the umbilical cord not midway but approximately 2 centimeters below the plastic clamp. So we will cut it now. And then we need to position our baby again into a skin-to-skin position. So let's just assume that this shirt is the skin of the mother. So after that, we can now perform the remaining active management for 3rd stage of labor. So we need to assess if the abdomen or if the abdomen of the mother is already contracted. So when the placenta starts to divide or starts to divide, it may produce globular shape or Calkin sign. It will sudden gush of blood will be produced, and the umbilical cord is lengthening. So now we will perform the control cord traction to deliver the placenta of the mother. So we need to support our hand here, And then we need to perform the control cord traction, wherein we will twist the umbilical cord and then down, side, up, slowly pull it, and then roll, down, side, up, roll, down, side, up, roll. And then when the placenta is already out, you need to support it below. And then you need to inspect the parts of the placenta. So the parts of the placenta must have its maternal, the dungkan or the dirty, and the shiny or the shalts or the fetal. So after inspecting it, we can now put it directly on the basin and then make sure to dispose it into a leak-proof container. So after delivering the placenta of the mother, make sure to inspect the perineum of the mother. So in here, we will still perform perineum care for the mother, wherein antiseptic solution will be used to clean the perineum of the mother, as well as we will inspect if there are any lacerations or if there are any tear on the mother's perineum. So when episiotomy is performed, episiotomy will be administered. So we will clean the perineum of the mother. So start at the top part going down. So we will clean it by the use of a water, and then a gauze pad. So we will clean it. When it is already clean, we can now administer betadine solution, and then we can now put adult's diaper. So we will just put the baby here, and then we will administer, or we will put the adult's diaper now on the mother. So after that is we need to inspect the baby's color and breathing. So we will inspect it. And then we need to remove our last set of gloves and then decontaminate it and dispose it. So after that, when it is time for the baby to be checked, so after several minutes during the delivery, after 12 to 90 minutes of the delivery of the baby, first is we will conduct physical examinations. However, we need first to administer the breastfeeding. So first is we need to educate the mother. So mother, if your baby shows breastfeeding cues po, such as your baby start to wiggle or to move his arms and legs, or if your baby po shows tongue movement or facial movements and crying po as the last sign of hunger, you can administer your breast milk na po. So you can position your baby into a cradle or semi-cradle position po. So you can administer now your breast milk, mother, because colostrum po is very important for the baby po. So after waiting for the after the first breastfeeding for the baby, we can now perform the physical test for the baby. So first is we need to assess the color of the babies and the breathing of the baby. So after that, we can now perform different kinds of anthropometric tests. So first is we will check our baby's temperature. So we will check the temperature of the baby by using a rectal thermometer. So we will rectally check the temperature of the baby. In here, we will assess the patency, or if there are any patency on the rectum of the baby. So we will assess. So okay, the baby is in good condition and the temperature is within the normal range. Next is we will perform anthropometric measures. So we will check the measurement of the head of the baby. the chest. So we don't need to include the hand, so we will just measure it below the hand. And then we need to measure the abdomen of the baby. So the measurement will start on the above the umbilicus of the baby, and then we will measure the length of the baby. So we need to start on the foot and then measure. So make sure to just measure it straightly. Do not curve the tape measure. So after measuring the baby, all the measurements are within the normal range. And then next is we will weigh the baby. So we will weigh the baby. So the normal weight of the baby must be 2,500 to 4,000 grams. So the baby is in a normal weight. So after assessing all the anthropometric measurements or tests for the baby, we can now administer erythromycin, or we can now administer eye ointment to the baby. So we will administer it from inner to outer canthus and then on the other side. So after administering the eye ointment for the baby, we can now administer the other vaccination or immunization that is needed by the baby. So first is we will start with the vitamin K. So we will aspirate 0.1 of vitamin K, and then we will administer it on the deltoid of the baby, or we will administer it rather on the vastus lateralis of the baby. So vitamin K will help the baby prevent any blood clotting, because babies have deficiency on vitamin K or newborn. So we will administer it on the vastus lateralis of the baby or on the upper thigh. So we will disinfect the surface, and then we will hold the knee of the baby to prevent the baby from moving, and then we will administer it. So administration must be like this, and then massage the muscle part where the administration will be done, and then administer it, and then aspirate the plunger. If there are no blood vessels hit, you can now slowly inject the vitamin K for the baby, and then dispose the used needle, and then you need to wipe the injected part again and massage it. After that, we will now administer the hepatitis K for the baby. So hepatitis K will be administered IM or intramuscular. So it will be administered on the thigh part of the baby. So we will still disinfect the surfaces, and then we will hold the knee of the baby and then slowly administer it while massaging it. Make sure to administer it on the upper thigh of the baby, and then slowly aspirate the plunger, and then slowly inject the medicine or the vaccine on the baby, and then remove it, and then discard the waste needle. After that, we will now administer the BCG for the baby. So hepatitis K will be used to prevent any liver diseases. So after that, BCG will be administered to the baby. So 0.05 will be used. 0.05 cc of BCG will be used. So the route of the administration will be intradermal. So we will hold the baby's arm like this, and then we will make sure to put the vaccine on the skin of the patient. But first, we will disinfect it, and then we will administer the vaccine. So make sure to administer it on the skin of the baby only. And then when you see hole, or when you see patch rather, you need to stop, and then just stop it and do not push it. So after administering all of the vaccines to the baby, we can now proceed on the dressing of the baby. So we will change our baby. We can now prepare our baby. So mother, ito po pala si baby. So healthy po siya, and there are no any complications that are found po. And then we can now put the baby's wristband. So we can put the wristband of the baby on the hands or on the ankle of the baby. So we will now put the newborn's diaper onto the baby. And we will start putting clothes on the baby. The baby, and then you need to swaddle the baby. This will help the baby maintain the heat or the temperature. So we will now swaddle the baby. And then, after swaddling the baby, we can now give the baby onto the mother. So, mother, ito na po si baby. So, mother, when the baby po shows breastfeeding cues, such as what I have said earlier po, you can provide your breast milk na po, because as we all know po, breast milk is very important po for our baby. So, also po mother, batting the baby po for newborn, it is recommended to bat the baby after 6 hours of delivery. So, okay po mother, your baby po is all healthy and all the results are normal. So, you can now have your baby po for grooming. And then, after that, you need to document all the results on the patient's chart and record. So that ends the essential intrapartum and newborn care.